So far we've covered the principles, the basics of eye conditions, why you get eye conditions. We've covered the principles of treatment. I want now to come down to the details of treatment, and I'm going to talk now about the points that are effective for eye conditions. Or perhaps I should be more truthful about this. I should say the points that I use for eye conditions. There are many points which are effective for the eyes, but of course, like all things, everybody's got their own favourite points which they use, their favourite treatments. And so I'll be talking about the points which I use time and time again. They keep on coming up in the treatment of eye conditions. Well, first and foremost is the point Cho Ho. Now, the Cho Ho is lateral to stomach 1. It's very similar in its effect to stomach 1, but we use Cho Ho because it's slightly easier to needle, especially when you're using deep needling techniques, which we're going to show shortly in another part of this DVD. The reason why it's easier than stomach 1 is that the eyeball is circular or spherical, but the orbit, the hole that it's in, is oval. And that means there's ever so slightly more space between the eyeball and the bone if you go slightly lateral. So it's quite close there, and there's just that little bit more space here, which makes it that much easier to needle this point. So that's I would say my favourite point for favourite local point for eye conditions. As a general principle, it's just a principle, one needles it superficially for problems to do with the front of the eye, such as sore eyes or dry eyes, or indeed to do with the muscles of the eyes. But you will needle it somewhat deeper, maybe 1.5 tsun, even as much as that, which is, how much is that? 30 to 40 millimeters, sometimes even as much as 50 millimeters for problems to do with the back of the eye, for example, retinal problems, arterial problems. Sometimes you need to do that even for glaucoma. And as I mentioned in the introduction, it's the use of this point which makes acupuncture special. This is a special thing that it's got, which no other therapy has got. It may sound rather scary using a 50 millimeter needle on this point. And indeed, it is a long way to go in. And indeed, you must take care when doing this. But I would say, on the other hand, that the eye is actually very robust. It's very hard to puncture the eye, especially with a thin acupuncture needle. So take care, as one of my teachers said, be bold, not reckless. I would say that actually the greatest danger here is not puncturing the eye, but is actually bruising the socket. It's easy to go too far away from the eye into the socket and causing bruising behind that, although I've never actually done that myself, I'm relieved to say. Now, the reason why you sometimes need to needle that point deeply is in order to get the chi sensation right to the back of the eye. You don't always need to needle it that deep, even in retinal problems, because it's the result that you're looking for, the result of the chi sensation at the back of the eye. And what I've found in clinical practice is that when the chi in the eye is very weak, puts in traditional terms a shu condition, then the needle will slip in effortlessly, and actually you can't get the needle sensation at the back of the eye or the chi sensation at the back of the eye until you've gone in quite deep. But by contrast, in a shu condition, for example, liver fire blazing up, you only need to put the needle in a relatively short distance and straight away you'll get a chi sensation at the back of the eye. So that's the result that you're looking for, and that's why sometimes you need to needle that point deeply. So that's my, as I say, my favourite local point. I personally find it easier to needle that than stomach 1, and easier to needle that than bladder 1. So bladder 1, of course, is the other local point, which is very good for eye conditions. And that also is needled, might need to be needled deeply in order to get the sensation to the back of the eye. But I have to say that my experience has been you don't need to use both stomach 1 or both Cho Ho and bladder 1. You only need to use one of them. It's getting, if you get the Qi to the back of the eye once, that's enough. So those are my local points. Perhaps you ought to count bladder 2 is also a local point. And there are, of course, a wealth of other points all the way around the eye. So as you know, bladder 1 is called Jingming. Well, there's also Jingming 1, Jingming 2, Jingming 3, upper Jingming 1, upper Jingming 2, and so on all the way around the eye. So basically, anywhere that you needle round the eye, you will have a point. There is an acupuncture point. And the indications of the acupuncture points, all of these points, is very similar. Like it's good for the eyes. They're all good for the eyes because they will all bring Qi to the eyes, or in the case of a full condition, they will disperse excess Qi in the eyes. I have to say, little aside, that when I was first trained, my first teacher, he would scorn the use of local points. He would say that's too symptomatic. But my experience since then has been that sometimes you actually need to use local points. Sometimes you need to use symptomatic points in order to break through, or in order to bring the energy to where you want it to be. And at any rate, for an ordinary acupuncturist like myself, I need to use local points. I think a really skilled acupuncturist who is very good at directing Qi would be able to direct the Qi from a point like gallbladder 37, Guangming, would be able to direct the Qi all the way to the eyes. But in my case, my needle technique, my ability to direct the Qi isn't that good, and it needs a little bit of local help by needling points around the eyes. So that's the local points. The next thing to consider are the near points. The near points include Taiyang, stomach 8, To Wei, Feng Che at the back of the head, Yi Feng, which we've talked about. Just a word about Yi Feng. It's good practice either to needle it towards the opposite eye, or alternatively to insert it a little bit lower. If you want to direct it up towards the same eye, then insert it a little bit lower than the conventional location for Sanjiao 17. Quite often this point is tender because of stagnation of Qi here, and what you're trying to do when needling this point is to release this stagnation. As we mentioned earlier, this point is one of the barrier points, the blockage points, and if you can clear this blockage, then it can often make quite a big difference. But blockage is a Shi condition, and when you needle fullness, it can be very painful. So be gentle. It's better to take more treatments than to cause so much pain that the patient doesn't come back. Those are some of the near points which I use frequently. Distal points, I use simple points like large intestine 4, liver 3, liver 2, the back shu points of bladder 23, that's Shen Shu, the kidney point, and bladder 18, the Gan Shu, the liver point. Sanjiao 3, symptomatically it's good for red eyes. Of course, liver 2 Xingjian is also good for red eyes, but has a disturbing effect on the liver, whereas the advantage of Sanjiao 3, Zhongju, is that it doesn't disturb the energy too much. It's like the acupuncture eye wash, as it were. It doesn't send you to sleep. Small intestine 6 is another point, and as I mentioned before, gallbladder 37. These are all well-known points for treating eye conditions. So that's like a brief rundown of points which I find myself using again and again. All of these will help the eyes, will benefit the eyes, and of course each one has got a particular effect on the organs which support and nourish the eyes, and so that determines the choice of point, as we will see quite shortly when we come to discuss individual ailments. What else do I use by way of treatment? Well, personally I use some herbs, but this is not about herbs. The other thing which I use is the microcurrent stimulation. I mentioned that earlier. This is something which is very helpful for people who cannot come frequently. It's very helpful for the patient that you know you can't change. So there are some people, they're approaching the end of their life, that there isn't a lot of room for change. They're tired, maybe they've got 5 more years to live or so. I mean, who knows how long they've got to live. But it's that sort of thing. No, I don't want to do big changes. I want to prepare myself for the big change which is going to happen soon. And so these people, they just need something just to keep them going. And the microcurrent stimulation, which they can do every day, can be of great help for them. I want to have a brief word about the relation with Western medicine and what it has to offer us. What Western medicine has to offer us is a diagnosis. It's actually quite difficult for us to make a diagnosis of what exactly is wrong with the eye. And this, I would say, has held back Chinese medicine and ophthalmology until the introduction of Western optical equipment. Western optical equipment has made fantastic advances, I would say, in the last, just as little as last 10 years. And so now it's possible to get extraordinary pictures of extraordinary clarity of both the back and the front of the eye, even from your local ophthalmologist. So use these pictures, use the resources which are available, get the orthodox diagnosis, and then interpret this in terms of Chinese medicine. Exactly what I mean by that, the details of what I mean and how you should use this, it will become clear when I talk about some individual diseases. But for us, for example, if a person is starting to go blind, it's difficult to be sure that they've got macular edema or macular degeneration, or maybe there's some retinal bleeding. All of these give quite similar symptoms of like fuzzy eyes, fuzzy vision, but they would require different treatment. Now you might say, it's easy. With Chinese medicine we make a diagnosis, it's easy. Actually, you want to use all the information that you can get from anywhere. And this will also become clear when we talk about one of the case histories shortly.